Good afternoon, Dr. Smith class. My name is Melissa Black. I'm a Kaiser University grad student. This is Psych 532, Health Psychology. In this presentation, I'll be discussing biosocial review of cancer. What is biopsychological model? Well, according to Solis, Luger, and Martin 2010, indicate that the biosocial model states that health and illnesses are determined by the interaction between biological, psychological, and social factors. Biosocial model seeks to understand the relationship amongst patient and the practitioners. This will allow the relationship amongst the patients and the services that are being provided to patients to allow the patients to improve what they're going through. And that's according to Engel, 1980. Cancer. The National Cancer Institute report that there were 8.2 million cancer-related deaths worldwide, with about 14 million of new cases. Cancer is said to be one of the world leading deaths that's evolving currently. According to the American Cancer Society 2016, there is a high rate of lung and bronchus found within the U.S. of cancer rate. The estimated death in 2016 based on cancer with both male and females are here. Lung and bronchus is the highest, then we have colon and rectum with 49,190. Pancreas had 41,780 deaths. Breast cancer had 40,890 deaths. Liver and intrahepatic bile duct had 27,170 deaths. And then we had prostate cancer, which was 26,120 deaths. Here we have just a list of different types of cancer that's there. As we learned, there's breast cancer, ovarian cancer, lung cancer, pancreatic cancer, leukemia cancer, liver cancer, there's esophageal and stomach cancer, melanoma cancer, colon cancer, multiple myeloma, brain cancer, prostate cancer, cervical cancer, normally found within women. There is sarcoma, bone, bladder cancer. There's childhood cancers. There are head and neck cancer. There's lymphoma cancer, uterine cancer, kidney cancer, thyroid cancer, and that's just a list of a few of the cancers that many face. Here I'll be discussing lung cancer, as we know that it's a high rate of smokers that are out there. And according to Rosenberg and colleagues, they indicate that mortality rate of smokers versus non-smokers is very high. Smoking is considered to be one of the leading cause deaths and a great impact of morbid and mortality, reporting about 430,000 deaths within the U.S. In the event, smoking can cause the lung cancer. But not only smoking, but even if you're not a smoker, you can also develop lung cancer. It is said that about 20% of people die of lung cancer are non-smokers. From experience myself, I have acid reflux GERD, and it's very important to eat healthy, not eat food that will cause me to vomit consistently, that can cause scarring of the esophagus. Foods such as staying away from caffeine, such as sweet tea, which I used to love, staying away from tomato sauce, which is not good for you. Having that disease that causes scarring of the lungs may put you at risk for developing a certain type of lung cancer called adenoma sarcoma of the lung. Another contributor to scarring of the tissue, tuberculosis, can also scar the tissue form within the lungs. People who have tuberculosis is also at double risk for developing lung cancer. This risk continued for more than 20 years to come. And this, as we can see, that it's not just smokers that can have lung cancer. Prostate cancer. I'm discussing prostate cancer because this hits a lot home, as my neighbor, whom I call Grandpa, was diagnosed with prostate cancer. And he did pass away, but it wasn't because it was due to a few complications. According to Kunkel, Baker, Myers, Oyasama, Sanmi, and Gomella 2000, the second leading cancer death in men is prostate cancer. It is said that many married men are usually quicker in being diagnosed with prostate cancer. Why is that? Well, they're married to a woman, which I know females will probably push their husband to go to the doctor or to get checked if they're not feeling good. Because as I've experienced, men can be quite stubborn in wanting to go to doctor. They don't want to go follow up to doctor. In addition, as I was stated, in 1998, nearly 39,000 of deaths accounted for those with prostate cancer, according to the American Cancer Society. White men are said to live longer than African men, American Indian men, as well as Hispanic men. At this time, it's unknown as to the cause of prostate cancer. However, family history, high plasma testosterone, high diet, and animal fat, as well as race, are possible risk factors. Many individuals who are diagnosed with cancer go through a lot of emotional phase, as we learn. Kunkel, Baker, Myers, Osanami, Gomella 2000 indicate that about 25% to 47% suffer from psychiatric syndromes. One of those is anxiety, which is one of the most common diagnoses of cancer patients. Treatments in prostate cancer can differ based on the detection of, I guess, basically what level they are, whether it's prostate, they're 4 or 3. Here is a list of symptoms within prostate cancer. Facing painful urination, frequent urination, blood in your urine, sexual dysfunction, pain in your bone, discomfort of the pelvic area as well, can be all signs of prostate cancer. There are few interventions that can occur to help reduce the rate of cancer. According to Bricker, 2010, smoking cessation intervention and pharmacotherapy, behavioral therapy can help individuals quit smoking, which can reduce that high rate of cancer. Motivating an individual that they can stop smoking, but we can motivate the person as much, but it also takes the person based on self-determination to help stop smoking and eat right and do what's right to try to help reduce cancer. One of the interventions also helpful is providing a support group for the individual. There are different types of treatment for cancer as well. Surgery, chemotherapy, radiation therapy, immunotherapy, targeted therapy, and hormone therapy that can actually help cancer patients. Here, as I mentioned before, there are different types of treatments. Here you will see the different types of treatments for prostate cancer. Surgery, as mentioned, is one of them that can be completed. Radiation therapy as well. Here you could review the list if you like to in discussion of the treatment options of prostate cancer. Another thing that will help cancer patients is physical activities. Fernandez, Franklin, Alamani, DeMelli, Lawson's, and Smith 2015 indicate that exercise is good for cancer patients and has shown a decrease in the side effects and treatments. About 22% of cancer patients in Canada were physically active. Common themes of exercises prior to cancer diagnosis: walking, swimming, cycling, running to help build endurance. There's recreational activities that can be done: golfing, skating, riding bikes, hiking. There's organization classes as well, such as Zumba, dancing, spinning, and Taekwondo. These can actually boost your energy a little bit, as we know that cancer could be very distressful for individuals. Laurie and colleagues 2012 indicates that about 50% of individuals with cancer experience emotional distress adjusted to being diagnosed with the cancer, and also facing struggles with the side effects of cancer and just overall symptoms with this disease. Psychological distress in cancer patients, according to Fowler and colleagues 2013, relaxation might actually help with emotional distress amongst individuals with cancer. Educating health professions such as nurses may also help individuals cope with cancer and be beneficial, as it can assist them in best used tactic ways to help reduce that stress and anxiety within the cancer patients. Also, psychoeducational intervention is another way to help cancer patients cope with psychological distress, allowing cancer patients to develop their self-efficacy. Physical effects. In a study, 146 patients with cancer, and there was a study conducted with 146 patients with cancer. 224 non-cancer patients were assessed on the side effects of physical and psychosocial chemotherapy. According to Lindley, McCune, Thompson, Lauder, Sauls, Atkins, and Sawyer in 1999, the study showed that about 50% of cancer patients lost their hair. 46% lost a sense of taste. 42% were always tired. The side effects affected their ability to perform work duties, and about 39% showed this effect. About 35% lost their sense of smell, being impacted by the chemotherapy of cancer. As for those who were non-cancer patients, about 82% faced financial hardship based on their loved ones being ill. Non-cancer patients were more frequently concerned about selected psychosocial symptoms. For example, household chores, not going to work, difficulty with the treatments, facing also anxiety, just like cancer patients. Thank you for listening to my presentations. Here are all the references that were conducted based on my presentations. As we can see, a lot of individuals face cancer. There's a lot of psychological, biological, and social factors that help contribute to cancer patients. It's very important that we try to encourage individuals to learn about the importance of risk factors that are out there for cancer, ways that we can help reduce cancer, treatments that can also be effective to cancer patients. It's sad that so many individuals are losing their lives over this disease, but it's a disease and a battle that we have to fight and be supportive amongst each other and hope for the best and help them through this battle. Thank you. My name is Melissa Black. and thank you for my presentation.